So my name is Brian. I'm a family nurse practitioner, student with Saginaw Valley State University. I'm going to be doing a head-to-toe assessment on you here. So first, I'm just going to have you stand up. I have a Snellen chart on the wall over there. I'm going to just have you walk a couple feet. You're supposed to stand 9 feet away. I'm going to have you read the smallest line. Oh, if you have corrective lenses, do you normally wear glasses or contacts?
Yes.
Okay. Are those in right now?
Yes.
Okay. All right. Read the smallest line. Cover one eye. And then read the smallest line.
DEFPOTEC.
Okay, so with the right eye, that's 20/20, and then left eye.
Oh. FELOPZZ.
Okay, and with the left eye, it's 20/25. And then can you tell me what color that top line is?
Red.
And then that bottom line there, what color is that?
Green.
Okay, I'm gonna take a seat right here for me. And gait was appropriate. I didn't see any swaying or any balance issues. Legs move symmetrically. I didn't see any deformities. I gotta grab the Rosenblatt chart. Okay, so we're testing near vision with this. I'll have you hold it 14 inches from your face and then read the smallest line possible.
937826 WMEX.
Okay, so 20/20, like I said, we're testing near vision there. So next I'm just going to
Stop. Hey.
every time,
Stop.
I'm gonna inspect your pelvic, or inspect your cornea, your lenses, your iris, and your sclera. So looking at your sclera, they're white. I don't see any signs of yellowing. There's doesn't appear to be any discharge. Venous structures are appropriate. Lenses and cornea, I don't see any opacities in the eyes. They are symmetrical, round. Coloring is appropriate. They're green or hazel. And then I don't see any no irregularities noted. And then I'll check the conjunctival sacs. So just looking for any blockages or drainages. Blockages or drainage. None are noted in your eyes there. So we would do the corneal reflex, where I would take this this piece of cloth here, or gauze, and I would touch the corner of your eye. We're not really going to do it, but you would look up and away for that test. And then, so after that, we would do direct and consensual, shoot, I don't have my pen light, I forgot something. Direct and consensual pupillary reaction. So, shine this in this pupil. Pupil on the left side goes from a 4 to a 2. 4 to a 2 on that side. Next, we're going to test consensual. So I'm going to shine it in this eye and watch that one. Okay. And the opposite eye constricted appropriately. Next, we're going to test cranial nerve 3, which is ocular motor, 4, which is trochlear, and 6, which is abducens. We're going to do that by having you test extraocular movement by going in the cardinal field of gaze. So I want you to keep your head still with your eyes only. Move and follow my finger. Okay. No lid lag was noted, no nystagmus or any abnormal extraocular movements. We're going to test for convergence. So all I want you to do is follow my finger as it moves closer to your face. Okay, and then accommodation. So what I want you to do is, I'll have you, I guess you can focus in. I want you to focus on my finger and then focus on my pocket behind it. Okay, all right, your pupils constricted and relaxed normally, appropriately. So we're going to test for red reflex. I don't want it all the way right. 1 or 0, excuse me. Okay, red reflex is noted. Red reflex is noted. Next, we're going to test for we're going to look at the internal structures of your eye. I'm going to put my hand here. I'm going to get very close to you. I'm just going to use my thumb to make sure we don't bang heads here. All right. And then the other side. Okay. Sorry, it's bright. So the ocular disc was noted. I saw the physiological cup in both eyes. You could see the arterial and venous structures in the AV junction. I didn't see any swelling or any edema, which would indicate potential papilledema. All the structures are easily identified, and you could see the So then from there, I'm going to do inspection and palpation on your scalp, and I'm going to inspect your face as well. Looking at your face, symmetrical. I don't see any deformations. I don't see any masses or lesions. So inspect and palpate your head. I don't feel any masses, lesions, or abnormalities. So I'm going to feel for your hair. I'm just looking at distribution. It's evenly distributed. Feeling the texture, which is smooth. And then looking at the color, which is brown. And then I'm going to part it here. I'm going to look at your scalp. I'm just looking for any dandruff, any scaling, any infestation, or any lesions, which none were noted. And then from there, we're gonna do cranial nerve 5, which is trigeminal. Excuse me. So first, we're gonna test the sensory portion of the trigeminal nerve. So I'm gonna have you close your eyes. Just tell me if you can feel it.
Yeah. Yes. 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 Yes.
Alright, so sensation was appropriate in the ophthalmic region, the mandible region, and the malleus region. So we're going to test the motor function of the trigeminal nerve. So I'm going to put my hand on your temporal muscles, have you clench your jaw, okay, and then on your masseter muscles, have you clench your jaw again, okay. Felt even strength on both sides. So next I'm going to feel, I'm going to palpate, we're going to do cranial nerve 7, which is facial. So I'm going to have you puff your cheeks, smile, frown, raise your eyebrows. So all those movements were appropriate and symmetrical. Next, I'm going to feel for your frontal sinuses. I'm going to palpate, palpate your frontal and maxillary sinuses, and then we're gonna percuss on those. Okay. All right. So percussion sounded normal. You're just listening to see if there's any dullness, which would indicate that there's fluid built up in the sinuses. So after facial, we go to nose, which is cranial nerve 1, olfactory. I'm gonna have you, we're gonna check for patency. I'll have you plug one of your nostrils and smell this. What does it smell like? Okay, and then other side. Okay. Are you able to smell it on that side as well?
Yep.
Okay. So patency was normal. Next we're going to use the otoscope, and we're going to inspect your nares. So just looking at hair distribution, looking at the mucosa, checking the turbinates, and then looking at the septum, making sure there's no lesions or septal deviation. She does have a septum piercing here. And then same bilaterally there. So that all the structures in there appear normal. The mucosa was a nice red color. I didn't see any drainage. Like I said, there were no polyps or nodules noted. So next we're going to move on to cranial nerve 8, which is auditory. So do you have any hearing issues? Okay, so we're gonna do the whisper test. I'm gonna have you plug one of your ears. I'm gonna stand behind you and say something, and you just tell me what it said.
Hello.
Okay, now the other side.
Hi.
Perfect. Next we're gonna do the Weber test for lateralization. I'm gonna hit this on my hand, put it on your head. You tell me if you hear it equally in both ears.
Yes.
Okay. Next, we're going to do the Renee's test, which tests for air conduction versus bone conduction. So I'm going to hit this, I'm going to place it on your mastoid bone, and then you tell me when you can't hear it anymore, and I'm going to move it to your ear, and then tell me if you can still hear it.
Okay. Yes. You can hear it.
Okay. Did it stop yet, or can you still hear it?
I can still hear it.
Okay. Other side now.
Okay, it's done. Yes, I can still hear it.
Okay. So air conduction is greater than bone conduction, which is a normal finding. Now I'm gonna palpate and inspect the structures of the ears. So I'm gonna palpate your tragus here. Just let me know if there's any pain or tenderness. Pull up on the auricles, and then I'm going to feel the mastoid bone back here. Any pain or tenderness with that? If you had any pain or tenderness, it could represent otitis media or infection of the ear. So next, I'm going to inspect inside your ear and look at the structures there. So I'm going to pull back. I'm going to use my pinky to make sure we don't go in too far there. Looking at the structures of your ear. I'll go to the other side. Everything appeared normal on that side, but I'll explain the structures once we look at both ears. Okay. All right, so tympanic membrane was seen on both sides. The cone of light was below the malleus. I didn't see any edema, I didn't see any perforations in the tympanic membrane. It was a pearly gray color on both sides bilaterally, so all those are normal findings. So after that, we're going to move to the mouth. I'm going to inspect your lips. I don't see any I don't see any splitting of the lips. They're pink in color. I don't see any signs of cyanosis. Can I have you open your mouth? I'm gonna look. Smile like that. Gums are pink in color. No signs of lesions or reddening, which could indicate gingivitis. All teeth are intact. I normally would use a pen light for this, but I don't have a pen light. I think it's in my car. Open up. Looking at the mucous membranes in the mouth, I don't see any like patches of white. I don't see any lesions or masses. So then we would do the cranial nerve 10, which is vagal. So what I want you to do is I just want you to open your mouth and say ah. Okay. All right. So uvula raised midline and soft palate followed, and then return to normal when she was done saying ah, and then the pharynx closed in symmetrically and then opened. So then normally we would check cranial nerve 9, which is glossopharyngeal. I would take this tongue depressor, I would stick it in the back of your throat, and I would check your gag reflex, but we're not gonna do that. And then we're gonna check your cranial nerve 12, which is hypoglossal. So I want you to open your mouth. I'm just gonna look at your tongue. Your tongue musculature appears appropriate, symmetrical on both sides. I want you to stick it out. So it moved out symmetrically. Like I said, musculature is appropriate, and then I want you to move it side to side. Okay, movements appear symmetrical. So I'm gonna have you open up again. I'm just inspecting your soft palate and hard palate, and then can you say ah again? Tonsils are intact, no reddening of the pharynx, and no lesions or masses noted. Next, we're gonna do cranial nerve 11, which is spinal accessory. So I'm gonna put my hands on the side of your face and just have to try to turn your head. Okay, and then on your shoulder and try to shrug your shoulders. Adequate resistance from both sides was symmetrical. And then I'm going to inspect your trachea. Have it tilt your head up, excuse me. It's midline. All right, have you keep your head like that. Feeling on your thyroid, the coracoid process, and then the thyroid rings. I'm gonna go behind you. I'm gonna have you just, you can just look forward. I'm gonna just place it slightly to the left. I'm gonna have you swallow. Okay, and then once again. Okay, rose appropriately. I didn't feel any nodules or masses. And then I just have to grab my stethoscope. Okay. So I'm just gonna listen for carotid bruits. All right, and none were heard. That is all for this portion.